everybody, welcome back to another episode of Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Moclobemide. Its brand name is Amira. Before we talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. So Moclobemide acts as a short-acting reversible inhibitor of monoamine oxidase. This is the enzyme that is responsible for the metabolism, or deanimation, of serotonin, norepinephrine, and epinephrine. In terms of indications for use, this may change based on what country you're watching from, but we would usually see Moclobemide used in the treatment of depression. It is occasionally used for anxiety, and although this isn't an indication, it has been studied in smoking cessation, and it was actually shown to be pretty effective. Now, before somebody was to use Moclobemide, there are some contraindications they must clear, as well as some precautions and warnings they should be made aware of. So patients who have a hypersensitivity to Moclobemide or any other component of the formulation would not be able to use this medication. Patients in confused states would not be able to use Moclobemide. And lastly, for contraindications, it should be noted that there are many medications that cannot be taken with Moclobemide. Some examples, but not all, would be bupropion, other conventional monoamine oxidase inhibitors, dextromethorphan, selective serotonin reuptake inhibitors, serotonin norepinephrine reuptake inhibitors, just many medications that affect serotonin, norepinephrine, and epinephrine. Now, in terms of precautions, patients must be made aware that they may experience a worsening of their depression upon initiation of an antidepressant. Some patients may experience suicidal thoughts or ideation. And although this is more common between the ages of 18 and 24, all patients using antidepressants may experience this and should be monitored. Prescriptions for this medication should be written in the smallest possible quantity that still allows the patient to get good quality care. And the patient's family or caregiver should be alerted to check for worsening of depression. They may see things such as anxiety, agitation, panic attacks, irritability, or insomnia. It should be noted that ocular effects have occurred, such as narrow-angled glaucoma. This medication should be used cautiously in patients who have hepatic impairment due to decreased clearance of the medication. Patients who use this medication that have bipolar disorder may put themselves at an increased risk of experiencing mania or hypomania. And it should also be used cautiously in patients who have renal impairment. It must be used cautiously in patients experiencing thyrotoxicosis, as it could result in hypertensive reactions. Patients who are slow metabolizers of CYP2D6 and CYP2C19 may experience elevated concentrations of the medication. Dietary restrictions of tyramine seem not to be necessary in patients who use Moclobemide, but it is important that they're made aware of the symptoms in case they were to have a tyramine reaction, which would be bradycardia or tachycardia, occipital headache, palpitations, and a stiff neck. And lastly, patients should be made aware not to stop the medication abruptly, or they may experience a discontinuation syndrome. Now, once somebody is cleared of the contraindications and made aware of the precautions and warnings, and they start to use Moclobemide, they can expect to receive their dose in tablet form. When it's used for depression, 300 milligrams would be given daily in 2 divided doses. The dose may then be increased after at least 1 week of therapy, and the maximum dose would be 600 milligrams per day. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using Moclobemide, so I'll go over some of those here now. Palpitations and tachycardia seem to happen just under 4% of the time. 3% of patients may experience hypotension or low blood pressure. 7% may experience insomnia, while 5% may experience agitation. Nervousness, restlessness, and anxiety have been reported. Constipation, diarrhea, and vomiting happen in about 3% of patients. Tremor happens 5% of the time, and about 2% of patients may experience blurred vision. Now, some more rare side effects would be abnormal dreams, aggressive behavior, suicidal ideation, urticaria, or visual disturbances. That's all we're going to talk about today with Moclobemide, or Amira. As always, I'm thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help me grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.